everyone, Rose Concepcion here. Welcome to the Money School. In this video, I'm going to be going a bit off topic because I think that it's really urgent to put out the right information about COVID-19. I've been seeing many people share unproven theories about dealing with the virus, and it's really sad because many people may end up following advice that may cause more harm than good. So in this video, I won't really talk about treating COVID-19 because I'm not a doctor and because I want to focus more on how we can prevent ourselves from getting infected in the first place. But I do know several very good doctors. And so if you are watching this video and you are sick but you are unsure how to treat yourself and you are having difficulty getting in touch with any doctor, please reach out to me and I will refer you to one of the doctors I know. This video is all about doing our very best not to get COVID-19. And in line with my channel, this is a very smart move financially because the hospital bills and aftercare of COVID-positive patients can amount to hundreds of thousands or even millions of pesos. Of course, we need to follow the protocols that are already in place. Wash our hands well and often, wear a mask and face shield, and keep distance from those we don't live with. But with the new variants that are spreading, is what we've been previously doing enough? It isn't. I've been hearing of more and more people who are cautious and defensive and yet still got infected. How? Some just went for a quick grocery run. Some were working from home, decided to report to the office for maybe just half a day, and then after got sick. The virus has gotten more transmissible. It's spreading more aggressively. Have you gotten more defensive? The virus has leveled up, and so should you. I would like to share with you my own family's protocol that has worked at keeping us safe from the virus. Even when my husband became a close contact of a COVID-positive person, he didn't catch the virus. And it could be because of the protocols we've been following strictly and because of the additional measures we've taken ever since new variants started appearing. The last protocol I will mention has been especially helpful, is scientifically proven, and is effective at reducing potential infection. Number 1, we avoid going out of the house as much as possible. Even grocery runs are now a risk we do not take. We order and pay online for anything we need, including medicines. It's quite easy to order through the Viber numbers of Mercury Drug branches. They will even honor senior citizen discounts if you just send them the needed documents. Number 2, if ever we do need to go out, we wear masks with filtration above 90%, and we ensure that they form a good seal over our noses and mouths. The day my husband was exposed to someone who later tested positive for COVID-19, my husband was wearing a NIOSH certified N95 mask. We never take off our masks outside, not even for a quick picture, especially if we are in an enclosed space. Number 3, when we are outside, we constantly disinfect our hands with 70% isopropyl alcohol, more often than other people around us do. We take our time washing our hands, ensuring to scrub well with soap every time. At home, we disinfect all packages coming from outside with cold plasma. Number 4, aside from keeping physical distance from people, we also make sure that we refrain from holding long conversations in person with people who are not from our household. We also do not let other people inside our house and don't go inside the houses of other people. I noticed that people are a bit lax when it comes to this, and I understand that humans need to connect. But if we want to avoid spreading the virus, we need to settle for video calls and e-Numans for now. Personally, I do not want to risk burdening further our healthcare workers. Number 5, This last protocol is especially useful, and I hope that many more people can adopt it. Every time, immediately after we go outside of our house and have potential exposure to the virus, we use betadine gargle and betadine throat spray. Povidone iodine has been proven through clinical trial to be effective in reducing viral load of COVID-19. And so, before the virus is successful at attacking your system, you can weaken it with povidone iodine gargle or throat spray. I prefer the throat spray because it's more convenient to use, but using either the gargle or the throat spray can help you stay COVID free and can even help COVID positive people with mild symptoms recover. I'm so thankful that my husband used the betadine throat spray immediately after his close encounter with the person who later tested positive for COVID-19. That may have made the difference in whether or not he got infected. If you want to read more on this, I put the link to the report on the povidone iodine clinical trial in the description below. To some people, our actions may seem a bit extreme, but these protocols have served us very well in keeping us safe and healthy. These days, we're just at home, but some are not as fortunate. Some still have to go out to report to work. And so if you do need to go out, I hope that you can make use of the tips I shared, especially the last one on using povidone iodine gargle and throat spray. Let's all do our best to end this pandemic. So those are my tips on how to be more defensive against COVID-19. Let's try not to get sick in the first place, as this can drain us physically, mentally, and possibly financially. If you found this useful, please like my video and subscribe to the Money School. Let's learn more about money. Thanks for watching. Bye!